This is CryoGovernance session for I3, sponsored by Cryoport Systems, and a big thank you very much for their support as always. We'll keep the bios short this evening, but the full extent of their resumes will be on the website. You can read about that on ivfmeeting.com. I'm joined, as you've heard, by a very good friend of mine, Cynthia Hudson. She's a highly accomplished embryologist and medical technologist for over 25 years in reproductive medicine. She's the VP of Clinical Strategy at Tomorrow Life Science, where she advances automated cryostorage technology, and has also co-founded major initiatives, including KindBody, Nova Genomics, and Perch Fertility. As a researcher, consultant, and president of New England Fertility Society, she continues to drive innovation and global best practice in IVF care. So welcome, Cynthia.
Well, thank you for the introduction, Giles. I think everyone here knows Giles Palmer, but in case you don't, Giles is also a good friend of mine and a clinical embryologist with a background originally in genetics. He has started his career at Hammersmith Hospital IVF unit with pioneers Lord Winston and Alan Handyside. He's managed and consulted for IVF labs worldwide. He's published extensively on genetic testing, cryostorage, and lab technology, and today serves as the executive director of the International IVF Initiative, where you are all today, connecting a global community of over 25,000 professionals. And then I guess I would like to begin. Today's topic: why cryogovernance matters, redefining risk management in IVF. I've had the privilege of working in IVF laboratories across the globe, designing facilities, training teams, and implementing systems that safeguard our patients' most precious assets. But in those decades, I've also witnessed something troubling: the same preventable challenges appearing again and again. Manual inventory tracking leading to confusion, fragmented custody chains during specimen transport, storage tanks without continuous monitoring, gaps in accountability that leave everyone, patients, physicians, and embryologists vulnerable when things go wrong. So here's the reality we face. IVF has experienced explosive growth, and with it, an unprecedented reliance on long-term storage. The stakes have never been higher. When we experience a mislabeled specimen, a transport failure, or a storage mishap, the devastation extends far beyond laboratory walls. Patients lose irreplaceable genetic material. Physicians face heartbreaking conversations. Embryologists question protocols they've trusted for years, and clinics confront legal and reputational consequences that can span decades, not to mention the damage and the pain and the suffering that the patients feel and experience when these things happen. Through previous sessions in the International IVF Initiative's CryoGovernance series, we've explored foundational principles of this integrated approach to risk mitigation. From early discussions on cryostorage management and electronic tracking systems, to deep dives into transportation best practices and systematic risk assessment tools like FMEA, failure mode and effects analysis, each session has built upon our collective understanding of where vulnerabilities exist and how systematic approaches can address them. Today, building on that established framework, we'll examine the current landscape through a critical lens. What are our biggest liability blind spots? What tools and technologies should we be prioritizing? And how can we translate cryogovernance principles into actionable strategies that protect patients, clinics, and our profession? This isn't just another theoretical discussion about risk management. It's about how understanding where the greatest legal and financial exposures lie and how emerging technologies and systematic approaches can close those gaps. To address these critical questions, I'm pleased to introduce three distinguished experts who will share their perspectives from the front lines of fertility practice. Beck Holmes will present Managing Risk at Scale, a network-wide lab approach. As a laboratory director with extensive experience in multi-site operations, Dr. Holmes will examine how risk management strategies must evolve when scaled across laboratory networks, addressing the unique challenges of maintaining consistent cryogovernance standards across multiple locations, diverse teams, and varying regulatory environments. Amanjot Grewal will share risk practice, the embryologist daily safeguards. Drawing from daily laboratory operations, Amanjot will explore the practical implementation of risk mitigation strategies at the bench level, whose critical daily decisions, verification steps, and quality checks that form the frontline defense against specimen loss, mix-ups, and procedural failures. Dr. Stephen Katz will conclude with risk and liability of infertility, a professional liability perspective. From legal and insurance standpoints, Stephen will examine the liability landscape facing fertility clinics today, identifying the most significant risk exposures, analyzing real-world case studies, and discussing how robust cryogovernance practices can serve as both preventative measures and legal protection. Together, these perspectives will provide a comprehensive view of risk management in modern fertility practice, from the individual embryologist daily protocols to network-wide operational strategies to the legal framework that governs our accountability to patients. And Giles?
Thank you. Thank you very much, Cynthia. Without further ado, I'd like to introduce our first speaker, Beck Holmes. Dr. Beck Holmes is the East Coast Corporate Lab Director for the CCRM network, overseeing protocols, training, and quality control across multiple labs. Originally from England, she earned her doctorate in biochemistry at Oxford, trained in embryology in Boston, and went on to direct IVF programs at Brigham and Women's before helping establish and lead CCRM's labs. A respected speaker and researcher, Dr. Holmes is passionate about advancing science in the lab to help patients achieve their dreams of having a family. So please welcome Beck Holmes. Thank you very much.
Thanks, Giles. Very kind of you. All right, so I'm going to talk about managing risk at scale and network-wide lab approach. So as Giles just said, I'm with CCRM Network, and we have a network of over 20 labs. So for CCRM, that's we're managing a lot of labs, a lot of different scenarios in a lot of different cities. And it's been interesting watching CCRM grow over the last decade. I've been with them almost 9 years, where we just had 7 labs, and now we're up to the 20. So lots of lessons and learning along the way. But one of our goals is always consistency between labs, from SOPs, media, reagents, storage, workflows, and somewhat the layout of the labs. So often you'll come into a CCRM clinic and it might be similar, depending on that geographical location, to another CCRM lab. And at the network level, one of our priorities is to build systems that reduce variability, increase predictability, and ensure traceability of every specimen across every lab. Now, that's both fresh specimens and also frozen specimens. So this is obviously essential for protecting both the patient's and the organization's reputation. So let's look here at traditional storage dewars and shippers. So we're all used to these traditional tanks and shippers that inhabit many of our clinics. Our rooms can be filled to the brim with tanks, many that have an alarm system that is outdated or maybe only tracking one data point. And the shippers that we're all used to here in the bottom right, I think, frankly, most of us will be very pleasantly surprised to receive a mushroom shipper in such good condition. So it's time to move on from these tanks and shippers to something that offers more data points, more traceability. And one thing that CCRM did was to think about solutions and who we can work with to offer this traceability, safety, and consistency. I think we're all very, very well aware in the US and in other countries more so, we're becoming very risk adverse. So practices that we used to do, for example, loaning out shippers, we don't do that anymore. We used to have patients come in, give a cash deposit, and they could use our shipper. We don't do that anymore. We're very risk adverse. And, frankly, we need a system that is going to be less time consuming, better to trace and track, less QC on our side, less things to sign off on. So hopefully we're moving in that direction towards a more unified system. So looking at traditional storage. So again, these are the tanks that we're used to. And if we think about scaling up, so depending on the age and the size of the clinic, one site could have from anywhere from 6 to 150 dewars on site if you include sperm as well. So for a sizable network such as ours, we could be talking in excess of 1,000 dewars to maintain. So, you know, this picture here is supposed to be overwhelming to the eye, and it is, because just think of the person hours it needs to inventory those tanks. Think about measuring the levels of all of those tanks, and making sure that everything's alarmed. So what we're becoming used to in this field is that there is an increasing need for storage. I think Tomorrow and others since then have really drawn attention to this issue and brought solutions to this problem. So if we think about, this is a slide from Tomorrow, a prediction from Tomorrow when they first sort of came along onto the market, where they're predicting their research showed that probably less than 1 million samples were stored in 2005. Now in 2025, the prediction is maybe more than 22 million samples in storage. That is a huge amount of samples, and a huge amount of samples to keep track of and to make sure that we are taking care of in and moving between clinics in a very thoughtful manner. So let's think about shipping of reproductive material. So this is both sperm, this is all sperm, eggs and embryos, and sperm as well. Most, I would say, if not all clinics have probably seen an increase in volume of shipping between clinics for a variety of reasons. I think we're used to patients becoming much more geographically mobile than they used to be, maybe even more so post-COVID, where people moved away from their in-person jobs and now are working remote. Some people have moved across to the other side of the country, maybe even the other side of the world. So people are just generally more in motion. So they may have to, move clinics in order to receive their treatment. Patients are also very, very savvy. They will change between clinics within one geographical location. They do like to shop around. I think we all could probably have examples of those patients within our geographical area. And of course, shipping is also required when we're using an offsite storage, whether that be clinic owned or a biorepository or a bank. And then there's probably internal policies that affect your shipping rates as well. For example, if you're going to be shipping off infectious disease samples and you have a lot of infectious disease patients in your population, then you're going to be shipping more than the average, more than another clinic. So a lot of clinics will have a dedicated transport specialist or an admin that will take care of a lot of the shipping. There's a lot of work involved in reviewing paperwork, getting things scheduled, and making sure that the patient is connected the whole time and knows what's happening. And I think another thing that we see also with patients is that because it's becoming more routine, patients feel like it's a safe process. And it is a safe process when it's done properly. So this is also probably adding to an increase in the shipments as well. So shipping on a network scale. Sorry. Within CCRM clinics, 2024, we did around 700 shipments in and out of the CCRM labs, with an additional 200 between the labs. So that's a lot of shipments going across the country, from CCRM labs to other CCRM labs, from local labs to into CCRM labs, out of CCRM labs. So there's a lot going in and out. And we needed to find a solution that's going to help us in our day-to-day processes. And we found that working with one vendor definitely simplifies that. And one of the things that CCRM is moving towards is a BioR model. The BioR model is really quite simple. It's a biorepository is simply a facility that catalogs, collects, processes, stores, and distributes biological specimens. So in our case, embryos, eggs, and sperm. And so you have your primary clinic, and then you ship your samples off-site to a BioR. And so you're shipping back and forth from the BioR to the primary clinic for multiple reasons, whether that's, embryo creation and the length of time that they've been at the clinic is long enough that they're now considered long-term storage. and you're bringing them back in for things like a frozen embryo transfer, for a discard. So there's a lot of busy work sending samples in and out of the clinic. And the reasons for using a bio are simple, mostly space, but also legalities. You're taking samples away off site, and they're being taken care of at a bio-R, where their job is to specifically just look after samples, and they have the expertise and the 24/7 care that we should expect for our samples. And the nice thing about using a bio-R or consistently using the same bio-R is that they're still considered our patients. So when we ship to our bio-R, they are considered under the umbrella of CCRM still. And I think patients appreciate that. So then if you scale up the bio-R model, so for example, we have our 20 clinics of CCRM here. There's a lot of going in and going out of samples. And so at the network level, the priority is to build systems that reduce variability, increase predictability, and ensure traceability of every sample and specimen across every lab. So when you're working at scale like this, you want something that is digitalized, a digitalized specimen inventory, both on-site and off-site with traceable shipping. You need to be able to track and identify quickly and accurately where specimens are. I'm sure all of us can relate to a last-minute frozen embryo transfer where we're alerted a couple of days ahead of time. Are the samples on-site or off-site? We need to be able to answer those questions in real time, quickly, and have access to that information, and have access and have the workflows available to bring samples back in last minute, if need be. So the shipping, we also want to make sure that is there's geofencing available, telemetry, so we know exactly where those samples are and what the temperature and situation of those samples is. So there are multiple reasons for wanting to digitalize your specimens. So here we are moving from conventional tanks to automated to more sophisticated tanks like the Tomorrow products, the Vaults and the CRSs. Here we are using RFID traceability. We find this a lot easier to track and trace all of our samples. It provides a uniform tracking system and chain of custody across all sites and all labs, so that we can log every specimen, it's monitored, and it's retrievable. So each of our labs has a unique storage solution that fits that lab, but it's consistent in its digital tracking and trace system. So some sites, for example, will have more on-site space. Thinking of my Minnesota lab. Whereas, I think we're all can appreciate that any labs that might be in Manhattan or the New York area might be a little bit more pressed for space and may not have as much on-site storage, and they might be a candidate within the CCRM model for shipping more samples off-site to a bio-R, purely for space and convenience of that. Okay. Excuse me. So when we're shipping back and forth from the bio-R, we expect to be partnering with somebody that has experience, a global support network, robust quality standards, validated cryogenic shipping systems, continuous monitoring, and insurance of specimens. And so this is imperative. Using a bio-R is all well and good, but if you don't have a reliable way to get your samples back and forth, the model's not going to work. So partnering with best-in-class is the way that we work to make sure that our samples are going back and forth in a reliable manner. So working with a vendor that offers continuous GPS monitoring and temperature monitoring is imperative. All of these factors are going to be reducing our risks. And these systems not only safeguard and reduce risk, but also help streamline operations and make sure that each of our labs is meeting the same high standards that we can offer to our patients. So moving to the bio-R model. So the learnings that we had along the way, we're a network of 20 labs now. We've grown, we've learned things along the way. Definitely start with a clean cryo inventory. Nothing is more time consuming than trying to ship out samples to a bio-R when your inventory is not matching whatever paper records you have or digital records you have. Do understand that initially it can be time consuming, but I always think of it as a one and done. So digitalizing your samples, moving them to a BioR is something that you're going to be doing typically just once. Of course, you're going to have certain subset of samples that are coming back and forth, but digitalizing those samples is one and done. And it can, yeah, I'll be honest, it's definitely time consuming. It's definitely straining on the eyes, but worth it along the way because you're going to be reaping the rewards with the digitalization. Make friends with your EMR system. It's wonderful if your BioR can talk to your EMR so that everybody's always in the loop, knows where things are, and you don't have to manually update things. So good to know your EMR system and your vendor so that if there are tweaks that need to be made to the systems as new workflows come along, being friends with them will definitely get you a long way with that. Solidify your workflows, have a plan in place so you know when you're expecting your FETs. And a lot of the time this is, you know, not necessarily lab based, but sometimes we have to work very well with our clinic side so that we know all of our upcoming FETs. There are always going to be those last minute ones that will slip through the cracks, but make sure that your workflows are good to ensure that happens as little as possible. Also understand your consents. So patients sign a consent when they're freezing their samples. We want to make sure that patients are aware that their samples may, or whatever your system is in your lab, that they may be sent away to a biorepository at some point. Not to say that they can necessarily opt out, but I think patients appreciate knowing what to expect and if their samples will be traveling somewhere to a different storage site. So there are a couple of different BioR models. One example is all samples go off-site, so you've only got very short-term storage on-site. So you freeze, you put into your RFID the sample, digitalize the storage of it, and then it goes off-site almost immediately, maybe at a regular cadence. Maybe you have a shipment with your BioR once a week. So you probably just got 1 or 2 tanks on site of your short-term holds, and everything else goes off-site. The other models are certain samples go off-site. For example, infectious disease samples may go off-site. You might want to be placing them outside of the liquid in a vapor storage. Maybe you're sending all your oocyte freezes off-site because typically those are going to be your long-term ones, depending on that patient's situation. Or another model is that the samples age out of on-site storage and then they go off to the BioR at that point. So this could be they age out after a year. If they've been sitting on site for a year, that's when it's time to send them off to the BioR, 2 years, 3 years, whatever is needed for your clinic. And so the beauty of this is that you can model this and you can sculpt it along the way to suit your needs. Maybe you're running out of space on site, so you move from 3 years on site to 2 years on site because you need to get a big bulk of samples off site. And making sure that you have good communication between everyone, so everyone knows where the samples are, and being digitalized is obviously going to be important along the way for all of these models. So the biggest thing I probably learned whilst we've been implementing this is communication and organization. This is what we require of ourselves, but also what the BioR model requires from our clinic. It keeps the clinic sane, and I think it also keeps your BioR and your shipping company sane as well. So I've talked about the work that's involved, but the rewards. So we're growing a network that can increase in size without compounding its risk exposure. We do have greater efficiency and transparency across sites and stronger resilience against both clinical risk and legal liability. So using our partners of Cryoport and Tomorrow had really helped us get to this reward state. So I thank you, and I'm open to questions. Oh, I just see that my slides didn't update. Sorry.
That was great. Thank you so much. We had a few questions come in. I think, just in the interest of time to get to the next one, we'll just keep it to one, but certainly there will be more later. Can you talk about how, your consenting and communication with patients regarding the BioR model? So there are legacy patients that have
Mhm.
already frozen things, in the
Yes.
past, and that communication, and then obviously for new patients going forward, if you've adopted a certain model, could you just speak to us a little bit about how you've
Yes.
implemented that?
We definitely, we have a lot of legacy patients. We've got some new clinics that have, the beauty of opening up brand new and they start from afresh, but a lot of our sites have a lot of embryos on site. And these patients froze with a consent that didn't even have the thought of a BioR on it. So what we chose to do under under direction of our legal teams was to connect with all of those patients via email and by physical mail, to let them know that we will be sending their samples off-site, but also giving them the option to opt out. So we have a list of patients that did respond to us and say, I don't want my samples moved from location X. And we respect that. And then for any new patients moving forward after a certain amount of time, when we implemented our new consent, which does indicate that after a certain amount of time, your samples may be sent off-site to a BioR. So we've taken care of the legacy patients by giving them notice, and then any future patients are aware because that's written into the consent.
Sure. I mean, I think giving ourselves some leeway, as we manage these clinical practices, right? Circumstances may change. We may have an explosion of growth and we may decide to shift. Like maybe we can't keep them on site for 3 years. Maybe we
Exactly.
can only keep them on site for 2. And, giving us that flexibility to best manage the patients,
Yep.
going
Yep.
forward.
Yeah.
All right, great. Well, thank you very much. Please stick around and I will introduce the next speaker. And our next speaker is Amanjot Grewal. So Amanjot is the scientific director of Pinnacle Egg Bank and the director of donor intake within the Pinnacle Fertility Network. Uh, Amanjot has graduate degrees spanning science, public health, and business. She's amazing. She combines scientific expertise with operational leadership to advance egg banking and reproductive medicine. Since entering the field in 2016, she's become a recognized leader in donor programs and laboratory innovation. Today, she guides Pinnacle's scientific vision, ensuring excellence, diversity, and patient-focused care across its nationwide and growing network. Amanjot Grewal, the floor is yours.
What a kind introduction. Thank you. Thank you.
You're
Okay. Hopefully that's working. Thank you again. My talk is called A Risk in Practice, an Embryologist Safeguard. Again, I am with Pinnacle Fertility, the Pinnacle Egg Bank team. I have no other disclosures or conflicts of interest. The goal for today is to really talk about a couple of things, and the primary objectives are to really talk about why it's important that we transition from cryo management to cryo governance. Walk through some of the action items for you all as embryologists, and then really talk about a use case, risk mitigation when it comes to transporting tissue. So as we've seen, IVF has changed dramatically, not only in the last 5 years, in the last 10 years, in the last 15 years, our practices have changed. We have seen an increased access to care, higher patient volumes than ever before. Per ASRM in the US, there was a 10% increase in cycle volume from 2022 to 2023. In addition, IVF has benefited from technological advancements over the years. We've seen more and more PGTA cycles, and that has resulted in increased complexity of the procedures that we're performing in the IVF labs. Based on the CDC data from 2022, about 42% of US cycles were planned as banking cycles, and that means that there's more tissue being stored today than ever before. And as Beck alluded to, we live in a very global society. Medical tourism continues to be very common in the IVF space. So we're seeing routine shipping of tissue to clinics both within the US and across the world. You're wondering, okay, I know this. I've felt this in my lab. I felt the stretch. I've seen clinics go from batching 1 week to 2 to 3. What does this mean for me? What this means is essentially cryo management is no longer good enough. Cryo management is a passive action, and we really need to transition to cryo governance. Like I've mentioned, IVF's rapid growth and increasing reliance on long-term storage has raised the stakes. More and more patients today are doing single embryo transfer. More and more patients today are going through PGTA testing, and those embryos are being cryopreserved more than ever before. And we have now seen the fallout from cryostorage failures. Cryostorage essentially underpins patient autonomy and future reproductive options. So failures or poor governance have major clinical and legal consequences. So as I've mentioned, the volume of cycles is higher than ever. The disposition options are more complicated than ever before. And now, while we always had risk and liability from cryostorage, there's an increased awareness, and there's now an immediate need for long-term planning. To be a good lab today requires integration of technical cryobiology with really clear policies on consent, disposition, traceability, staff training, and ultimately contingency planning. So this word good, what does that mean? Historically, embryology labs were called good for a variety of reasons. Labs that had really high success rates, labs that adopted or pioneered technology and new protocols, labs with really good workplace culture, and all of those are still incredibly important. But I would argue that today, good is best defined by safety. And by safety, I'm referring to risk mitigation. So in the IVF lab, as an embryologist, your risk is a function of a couple of things. And here are some kind of broad categories. It's a function of the resources that you're provided. It's a function of the SOPs and documentation that is put in place. It's also a function of how well staffed your laboratory is. But your risk is also a function of you and your choices. One of the analogies or metaphors I use with different embryologists is this idea of highway hypnosis. Maybe many of you have gone on a long car ride and you are somehow 200, 300 miles from where you started with no recollection of the last 200 miles. As embryologists, we can't live in this altered mental state where we don't have a recollection of consciously doing X. And in this case, X refers to cryomanagement. While we can operate on autopilot in the car, in the IVF lab, we really do at this point need to make some very clear decisions and again, transition away from management, which is a passive action of triaging samples as they're frozen, and move to governance where we're thinking proactively about long-term solutions. So I encourage everyone to reflect and then act. So one of the exercises that I have recommended to many is this idea of an internal report card and really evaluating very candidly and very honestly specimen labeling in your lab, gaps in chain of custody, your cryotank monitoring and maintenance, shipping coordination and services, your data and record keeping integrity, as well as gaps in the consent form. And then at an annual level, and this is really nice for those that are regularly doing their, that are part of CAP, that are doing their self audits, including it with that, or maybe with your annual SOP review, to think through the market and think through what is going to keep you safe, what is going to mitigate your risk, and think about, is your witnessing sufficient? So for example, if we were to talk about witnessing, do you have a witnessing step throughout the entire life cycle in the embryology lab? Or let's say, for example, when you go to cryo, your cryo device doesn't have a witness. That label doesn't have a witness. Making sure that you have witnessing throughout the entire life cycle in the embryology lab, reviewing your documentation practices on an annual basis, looking at your cryotank inventory audit so that you know what you have on site and what is off-site, reviewing and updating consents as needed, and regularly reviewing for compliance. These are all the things as an embryologist that will keep you safe. I know I've talked about embryologists and cryogovernance, but I want to be really explicitly clear. Everyone in the clinic is responsible for cryogovernance. And that's because there's so many stakeholders that are involved. Your clinical team, your medical directors, for those that have operational team members or office managers, everyone needs to be involved in the decisions for cryogovernance because it really does impact the clinic on a larger scale than just the IVF lab. So for example, if we think about on-site storage tank monitoring best practices, I think many of us are doing these, and these are the minimum, but recommending 1 to 2 times a week that we do 1 to 2 times a day, a daily visual or physical inspection. For our programs, we have what's called the foils inspection, so frost on the outside, ice, leakage, evaporation or condensation, or sounds. Doing manual dipstick checks of liquid nitrogen prior to filling and calculating loss since the last measurement. Considering measuring weight if that's something that you can do in your space. Fill with liquid nitrogen at least once a week. Ultimately, being vigilant and having strict quality management practice is important. But part of CryoGovernance is thinking, are we at the point that an offsite solution is needed? So for example, if a rolling base tank can accommodate between 150 to 200 canes, based on the volume of your program and based on how much cryo you're doing, you can reasonably expect in some programs to have 1 to 2 tanks added to your program a year based on the amount of cryo that you're doing. And that is all part of CryoGovernance, is really being proactive and thinking through the best practices for today, but ultimately what is going to protect you in the lab and your clinic going forward. CryoGovernance has, a really it's really important when we think of cryogovernance that we balance and integrate all the different principles. So while I've talked about good practice guidelines, for me, the biggest piece is safety and risk mitigation, regulatory compliance, and balancing those with, again, we're embryologists, we're scientists by nature, making sure that we still continue to have high quality technical and clinical performance and operational excellence for not only ourselves, but also the patients that we work for. I'm going to shift a little bit and talk about shipping considerations, and it's important to me that the same cryogovernance principles that we've talked about until now, that we continue to keep those in mind as we move forward. So for clinics today, there's a myriad of options that are offered to patients. Some clinics will allow patients to hand carry. Some will have a clinic representative, so an employee of the clinic, not necessarily an embryologist, but a clinical team member transport the sample. Some use non-specialized local carriers, and some require a specialized reproductive tissue transport company. Some clinics offer all of these options, some offer just one. We're seeing really a wide array of options. And so what I would ask is, depending on all the options that you offer, that you think about all the variables that impact your shipping tank hold time. And in all of those scenarios, there's different weights and counterweights to assign to each thing. So for example, there's environmental variables that will impact your shipping hold time. For example, the orientation angle, the equipment, the people, materials, and other methods. Think about how a patient self-carry may vary from a specialized reproductive tissue carrier. So just to kind of walk through that sample, now in the laboratory, when it comes to identifying the samples to ship, we should be following the same process for loading. But where the variables start to become increased compared to a specialized reproductive tissue transport courier is whose tank is being used. Is it your clinic? Is it the clinic that's receiving the sample? What inspections are being performed prior to or after the shipment? Are we doing a physical check? Are we doing a manual dipstick? Are we doing a weight in and out? And are we doing that nitrogen evaporation rate calculation if it's our tank? And who takes on that risk? What does that mean? And then finally, in the case of a patient self-carry, what level of information do patients have about how to maintain the tank in transit to their clinic? So the education, instructions that they're given, and the consents that they complete. What level of risk are we introducing to our clinics when we offer different options? And do we have SOPs that cover all of these scenarios? I would encourage you, when you go back, that report card exercise, really think about all the different options that you offer, and do you have very specific and detailed documented steps for each of those different transport types? Shipping should not feel like a black hole. A patient or a courier should not walk out of your clinic with tissue and you have no idea what's happening next. And you're just waiting and hoping that it arrives safely. So it's really important in the same way that all of our other lab functions have chain of custody. So for example, from the andrology lab to the embryology lab, from specimen collection, labeling, processing, we need to have chain of custody when we're handing off samples, both internal to the lab and then in this case with shipping external. For an embryologist, your strongest safeguards, in my opinion, are double witnessing, documentation, and I've probably said that 100 times at this point, and really strong partnerships. When we're thinking about partners, a couple of questions to ask yourself: is your partner holding themselves to the highest standard? So if you're working with a shipping company, are they compliant with regulatory bodies as applicable? Have they gone above and beyond and they're actually looking at elective certifications? Are they doing self-inspections? And do they have a really strong QA, QC feedback loop? And then second, is your partner embracing change and incorporating it into their systems? As we know, the IVF space has changed dramatically over the last 20 years, 10 years, 5 years, since last year. And so evolution and innovation are necessary. And having a partner that has a knowledge of this changing landscape, that's embracing it, and actually is pioneering that, is incredibly important to continue to offer the safest options for your patients. So when looking at partners, and similar to any other, when looking at shipping partners, one of the things to think about is, what does validation mean to that program? So what checks are in place to ensure that prior to loading samples, the tank is safe, damage-free, and going to maintain cryogenic temperature during shipment? So validation really should look at a couple of different things. And I encourage you to ask these questions of any partner organizations. Is condition monitoring, is that something that's available? So internal and external temperatures, humidity, orientation, and making sure that that monitoring is regular and has frequent transmission. Making sure that the cases or the equipment that's being provided is engineered and validated for safe transport. How long the internal hold time temperature is for that tank. And then what does that partner do in terms of shipping requalification? So how often are nitrogen evaporation rates being measured? Are they assessing for some of the visual damage that we talked about with the long-term storage tanks, the stress fractures, pinholes, vacuum integrity? And are they checking for data gaps? Having a partner work with you on the validation side from a laboratory perspective is one less thing to think about. And I think that's really important, that we acknowledge all the different things that we do in the laboratory. And I, running joke, ICSI takes maybe 2 to 3 minutes, but validate your paperwork at the end of the day will take you 20 to 30 minutes. So, as much as we can, reducing some of that burden on our laboratory teams. And then what does that logistics partner do above and beyond equipment and validation? So are they providing regulatory support if you're shipping to another country? Are they providing packaging materials? We've already talked about shipping tank validation. How responsive are they when you have a question or a concern? And then finally, and I know Dr. Katz will talk about this later, sometimes things go wrong. And that doesn't mean that it has to be catastrophic, but there can be near misses that are a learning opportunity. So how do they help you troubleshoot? So for example, in addition to FedEx, what tools do they have, like GPS geofencing that Beck mentioned? What is the logistics company responsible for versus you, the clinic, and the embryologist? And what does communication look like to you, the receiving clinic, and the patient? And so I'll end with, again, just reiterating that cryogovernance is not solely the responsibility of the embryology team. It is meant to be an opportunity for all the stakeholders in the clinic to come together, talk about safety and risk mitigation and what that means for your program. Understanding that programs are, some are cycling 100, doing 100 cycles a year, some 5,000, and what that means to them may look very different, as well as the space that they have and the personnel that they have. I encourage embryologists at all levels to be involved. It's important that those that are handling, for example, your shipping coordinators in your laboratory team, are involved in these conversations so that they understand why, and that they can provide some real boots on the ground feedback about what's going well, what questions they have, and opportunities to really govern and manage those processes going forward. And again, just emphasizing that we are at the point now where we need to anticipate continued growth, continued cryo storage concerns, and the volume of cryo storage. So we need to build our programs based on the future instead of being reactionary. And with that, I'll say thank you.
Thank you very much for excellent talk. I think you covered all those points fantastically. I particularly like the way that you mentioned like a black hole. Often when you send samples out, are they that black hole? But can you tell me your experience with technology and tracking? How do you not make that a black hole? Often we get couriers that arrive when we're busy, we have to down tools. But again, there's also that tracking point because the patients, want to know where my samples, are they there yet? Because a lot of cycles cannot start until those precious samples are there. So how do you make it not a black hole then?
Yeah, that's a wonderful question. And I agree. I think Amazon has changed shipping. Some would say for the better, some would say for the worse. I can see when the Amazon truck is at the stop before my home. And while I don't think we're at that point just yet, we're not quite that granular. For example, we can expect of couriers to have a direct line of communication, and that makes it, you may be still in the galaxy, but you're no longer in that black hole. So for example, if you are a program that works with local couriers, asking them for a direct line of contact to that specific driver. I also really encourage the creation of boundaries at clinics. So I know many a times you're in a laboratory and you get pulled out to pack a shipment, a courier is waiting, but making sure that you have really defined pickup drop-offs so that one, your laboratory processes that are timely are not disrupted, but two, it allows you to have a sense of awareness of, when tissue is leaving, when it's coming in, but establishing a direct, who is the driver for this shipment? Who do I reach out to for this specific case? And in our programs, we actually have documentation that the receiving clinic completes and submits back to us so that we have created this loop, not only with the shipping company, but also the end recipient that we provide to them, or that we get back once they've received.
Okay, well, thank you very much. There's a lot of questions for you, but we'll get back to that at the Q&A session. I'd like to now introduce our third speaker, Dr. Stephen Katz. Welcome to the webinar. He has dedicated his career to the advancement of reproductive care since 1995. After training at Cornell and UCSF, he directed IVF programs and founded Fertility Associates of the Bay Area. He later formed IVF Centers of Excellence and, drawing on decades of experience with clinics and labs, recognized the need for stronger risk management in the field. Today, he leads REI Protect, focusing exclusively on risk prevention and claims management for reproductive medicine. So I'm very much looking forward to this talk. Take it away, please, Stephen.
Well, thank you, Giles, and thank you for the invitation to speak today. And it's really nice to see so many friendly names on the attendee list. And as Giles said, we're really going to talk about a professional liability perspective in our space today. And I'm excited to talk a bit about this because you all know that I've really dedicated the last part of my career to protecting you all. So the objectives today, I'd really like you all to appreciate that failure of accurate tissue transport and cryostorage is a real risk to our space. I'd like you to accept that the days, as Amanjot so correctly spoke a few minutes ago, that the days of non-specialty transport tissue companies have really ended. I'm hopeful that you'll all agree that safe cryostorage is of critical importance in maintaining patient confidence. And again, for all to appreciate that the future of IVF and fertility care really depends on safe cryostorage. Let's talk a little bit about the current landscape of legal exposure in fertility. We like to talk about the phrase high severity. We don't have that many claims or mistakes in our space, but when they do occur, they can be of very significant severity. So you may hear the term low frequency and high severity, but I'm certain that high severity really rings a bell. One of the concepts we talk about as the whole IVF space evolves is, what is the value of an embryo or an oocyte, an egg? That really determines the severity of an error. And you all can relate to years ago, the claims of an enormous value to a single embryo or an oocyte. We're going to talk about that a bit today, and we're going to start to talk about really replacement cost as a novel idea, looking at what is the value of a single embryo or an oocyte. The other pearl I'd like to give you in the current landscape of legal exposure is your professional liability carrier must have an REI-specific risk management program. For you to have professional liability coverage and call in with an acute error or an acute emergency for which you need guidance, and for your carrier not to understand the field you're in, is difficult. And, you know, Cynthia, if you remind me, I can tell the Trader Joe's story at the end of the talk. Many of you have heard me talk about the Trader Joe's story, but I think it'll resonate and ring a bell with many of you. So the current landscape of professional liability coverage in fertility. Most carriers have actually left the space in the past 2 years. It's gotten too risky for them. Without the expertise in their company, it's really impossible for them to ensure and ultimately defend the claim. We're so specific as an arena of medicine that most carriers have actually left. Premium cost is not really the issue per se. They don't feel that they actually can charge enough premium to carry the risk of what could happen in the IVF lab or even in the REI practice. So I want to focus on the statement, cryogovernance is now mandatory rather than voluntary. If you're applying for professional liability coverage in our space, you'll be receiving many cryogovernance questions. That's where we are. Let's talk a little bit about current trends in lawsuits and where professional negligence claims are coming from. It's not the purpose of today to focus on genetic testing, but genetic testing errors and related claims are the most common. Mislabeling events and related cryogovernance mistakes are the second most common. So really important, a very common etiology of what we're facing in terms of claims and lawsuits. I also want to share with you the misnomer. Tank product failure events are really uncommon and rare. We don't walk into our labs and find the tank one morning shattered in 1,000 pieces. The product itself, the tank itself in terms of storage, is very safe. As Dr. Holmes and Amanjot talked about it, really the focus, the expertise in monitoring the tanks themselves is what's really critical. So why are the consequences of mislabeling events and cryogovernance mistakes so severe to the patient? because it creates potentially true loss of the embryos, or oocytes. Depending on the situation, the embryos and oocytes may not be replaceable. You may have a wrong child born. That's why the consequences are so severe. Why are the consequences so severe to the doctor and the practice? Tremendous and potentially fatal reputational loss. Potential loss of the license to practice. Potential loss of the ability to find professional liability coverage moving forward. Without professional liability coverage, the clinic can't stay open, the lab can't stay open. It's crucial. But I also leave you with my last bullet point. All of us have been trained in medicine to do the best we can, to help patients, not to cause harm. And when we make mistakes in cryogovernance, mislabeling events, we've caused harm. It's emotionally devastating to all of us, all of the lab personnel, all of the medical providers, and all that are working so diligently and hard to support the success of the clinic, to help patients have families. So while reputational loss, the ability to practice, the ability to find professional liability coverage are all important, equally, if not more important, is the personal core values of do no harm. So where are IVF labs exposed? Dr. Holmes and Amanjot already talked about this. Witnessing failures, storage failures, insufficient monitoring, human error in checks. I hope that manual tracking is a thing of the past. Reliance on handwritten logs and labels, they just increase the chance of mix-ups and misidentification. You all know that 10 years ago when I started REI Protect, it was really to bring modern professional liability coverage to our space. In essence, I saw the risk really focused on the IVF lab, and we brought that coverage to market. And so now I'm trying to lead the way on modernization of techniques in the lab to prevent these mistakes. Amanjot specifically really focused on transport mishandling. There's a tremendous amount of shipping going on, as Beck said, between clinics and a network, or between clinics to a BioR, or from clinic to clinic that are unrelated, either domestically or internationally. You must have a medical transport specialist. Beck specifically mentioned Cryoport. Cryoport clearly leads the industry in this type of specialty transport. You must have shipping with continuous GPS and temperature monitoring. You must have oversight. You must have continuing verification of chain of custody. So how do you lower the risk of a mislabeling and cryogovernance error? We've all talked about it. You cannot go another day without an electronic witnessing system. Your IVF lab needs track and trace technology in and out of the cryo tank. The BioR model here is very protective. We haven't had a single claim in our program related to BioR technology. The cryotank must be monitored with state-of-the-alarm systems. Amanjot talked about it. Use the weight sensing platform company that's available. The weight sensing platform is weeks ahead of a temperature probe. You can use both if you wish, but please focus on the weight sensing technology of these cryotanks. You need a long-term off-site storage partner. That's been said many times today. And again, you need a proven state-of-the-art shipping transport partner. Crucial. I'm sorry to say this, but I think without these technologies and relationships, you'll likely become uninsurable in the next year or so by any quality carrier. The risk is just too high to making a mistake. So please take the information today and go back and look at the modernization of your lab. So I end today before we open for questions. And I've never said this before, but when I wrote the talk, I mean it. The information provided on this podcast today may be the most important information you've heard in the past decade in how to protect you, your patients, and your practice. Protecting your patients' embryos and oocytes requires a full team effort. The legal landscape is very unforgiving for mislabeling or cryogovernance mistakes. And do not count on a general professional malpractice carrier to be there for you with a mislabeling or cryogovernance mistake. They simply do not know what they're insuring. So I want to thank you all for having me, and I really appreciate being on today. And I think this has been an incredible podcast, and I want to thank Giles and Cynthia for putting it together.
Well, that was really enlightening. Thank you, Dr. Katz, for sharing your pearls of wisdom here. There's a bunch of questions, but before we open it up to the group, I just want to highlight one. You mentioned, you talked a lot about liability and, and the responsibility of the clinic and the transport company and the patient. And I guess, could you give us your thoughts on, the biorepository model, with the clinic? How does that, does that transfer liability then to the biorepository? It lessens liability theoretically for the clinic. How would you suggest a clinic approach thinking about that? Is there an opportunity for reduction in liability if they move samples off-site? And, what are the things for them to consider?
Well, the most important thing, Cindy, is that the BioR is a safer model than storing in your own clinic. And the reason is, in my opinion, at the BioR, they're doing one thing. They're storing the samples safely, and their entire focus is on that. In the clinic, there are so many, in the IVF lab, there are so many things going on. Isolation of oocytes, fertilization, culture, embryo selection for transfer, not to mention all of the surrounding relationships with pre-implantation genetic testing. So I hope no one could leave here today and think that storage in the IVF laboratory is as good or safer than it is in the BioR. That is a really important message. I look at liability a little bit differently. I want to protect everybody, but I want to protect the patients first and foremost. And by storing patient tissues in a BioR, we're protecting them first and foremost. Is the clinic transferring liability at some level to the BioR? Of course they are. they're sharing in the liability with the BioR company. But that's not necessarily my focus, to relieve liability from the IVF lab. My focus is to make changes that are safer for patient storage.
Sure.
So if you don't have, not you, but if an IVF clinic doesn't have a long-term relationship with one of the leading BioR companies in the country today, I hope by October 1st they do. I know October 1st is in a few hours, but that's how important it is. Really, I mean, it's the entire future of safe storage.
Yeah, I think there's a lot to think about as we evolve our practices and, incorporate, with this adoption of technology, and how can we continue to serve the patients in the best way that we can. So I will open it up for the Q&A session. Thank you, everyone. This has been really good so far. Giles, care to lead us off?
Okay, thank you. I'd like to ask Dr. Katz a question again. We spoke about, and the other speakers can chip in if they want to, but in the States, they're very risk adverse, and of course, there's a lot of litigation. Isn't this problem just a problem for North America and the States, or is it a global problem? Is the focus the same that we're seeing in other countries?
It should be. I mean, the focus of risk doesn't rely on one country or one geography or one venue. That's why, Giles, great question. I'm focused on patient safety. Patient safety for the gentleman in Egypt who's on, or Africa, or in the UK or the US, whether it be New York or Omaha. Patient safety is what we wake up in the morning to protect. So yeah, different venues have different levels of litigation, absolutely, but this is a universal and international focus.
Okay, thank you.
Great. Dr. Holmes, there's a bunch of questions around, again, the BioR model and, how it works. And, if we think about, if I adopt this model, then, how can I incorporate that into my clinical practice? So, what are your suggestions, for the group to think about, if they're going to adopt a BioR model, which one should they adopt, right? Should they think about just isolating certain classes of tissues, think about the frequency of those transports, what, is obviously they can't go back and forth daily, but
Yeah,
what would you think
yeah.
about, like weekly or monthly, what are the things to consider as you look at your program and think about how to scale that part of the business?
I think it depends on where you are in relation to your BioR. So for example, our New York site, tomorrow's down the street. So, we can do shipments probably a little bit more frequently because we also have vans that will travel around that locality. But for the majority of sites, we're doing we're shipping every 2 weeks. So we'll hold patients, we'll know that they're going to the BioR, and then we'll ship them every 2 weeks, and then we'll pull patients back on a routine basis. But I think your model really depends on what your needs are. I think it's easiest to say a sweeping statement along the lines of, okay, anybody over a year old or been frozen more than a year, I should say, should be shipped off site, so that you have defined limits of, that in January next year, this cohort of patients are going to be due to be shipped off site. So it's a month by month process. So I think ideally having that on a rolling basis, so that if that if you're shipping off at a certain cadence, that your January patients are going to get shipped off, you can get them prepped and ready and have that shipment organized with your BioR. And then in terms of coming back, always having that constant communication is really key. But having that organization as well, so that we just have a list and we'll put tickets in. Tickets are what we use for communicating from the EMR. So picking the specimen in the EMR, embryo number 1 for James Smith. We'll put a ticket in with our BioR. They'll get that on their end, and they know, like, okay, well, CCRM Boston has asked for this embryo back. They've got a scheduled shipment next Tuesday. We'll pop it in the tank with them. So having something, a set cadence is going to be important in terms of shipment out and in. But you can also do bulk events as well. So if you need to get several tanks off-site or out of commission because they're getting old, you don't have space for them, you're going to do some construction, you can organize an event that is like a reformatting event, essentially. So you're going to digitalize all of those specimens and get them off-site in bulk. And typically your BioR will help with that, which is obviously a godsend to make sure that we save our sanity, our eyes, and our backs as we're doing these reformatting events. I don't know if you're familiar with that, Cynthia.
Maybe I've read about such things, but yeah, no, it's critically important to have that partnership and that communication, because we're all serving the patient, on different levels.
Yeah.
And
And one thing,
Giles, I think it's your turn.
Yes,
Yeah.
Okay,
Sorry.
so a question now to Amanjot. You spoke about, the corporate structure you have, the many clinics you have, the policy. Can you explain a little bit more about how you train the staff? How do you train someone in cryogovernance? Because it's not what they expect, is it? It's not something that we train for before we go into the job. So
Yeah.
how do they train for that?
Yeah, absolutely. It really is a shift in perspective. I think embryologists are technical by nature and that scientific mind. So thinking about risk is something that some of us may on a spectrum be more familiar with and less familiar with. But I think when we're talking with juniors, mid-levels, starting those conversations really early in their developmental journey, I think we're at the point where we're starting to see some of the wave of retirement in our embryology brain pool. And so it's so important to me as we bring on new team members that training and that knowledge and that thought process starts really early. So juniors and mid-levels are proactively asking questions and making it so that those questions are welcomed in the space, and that we talk about, this is how we've been doing it. But there's always opportunity for improvement. There's always partnerships that yield. So for example, on the egg bank side, we use Cryoport for our shipments. There's really new and exciting things happening. How do we implement those? How do we bring those in-house and use that for our program? So developing that thought process is encouraging the most basic intrinsic part of embryologists, that natural inquisitive nature. And we just need to keep pushing that in that youth, that really young population, so that they continue to ask good questions and continue to move forward with thinking proactively.
Okay, thank you.
That makes a lot of sense. Dr. Katz, there've been some, you made some pretty bold statements about, that IVF clinics would potentially not be insurable, and, they need to really focus on adopting these best practices. And, I guess how would you describe or think about or help people to get, well, okay, I've always done it this way. I have a manual witness. I have a human doing this. I have all of these systems in place, and isn't that good enough? And I guess how do you think about, how do you talk to clinics and doctors and embryologists and these groups, and how do we get them over that line, if we really think it's that important, and if you really think they're not going to be insurable, what is that conversation like? Why isn't this good enough?
Well, Cynthia, I really have a couple of answers. The first is tangible. In the insurance industry, the carriers are telling me that unless there's better cryogovernance in our industry, they won't be around. They don't use the word cryogovernance. They're not that sophisticated in our field, but it's the same message. When I speak to clinics to get them beyond the hurdle, it's often the statement that they say, we run a very tight ship. We don't think this is ever going to happen to us. And that breaks my heart, because it can happen to anybody, any day of any week, especially on the weekends. So I study all this data. many of you who know that I give talks, what is the etiology of the modern RAI claim? So we study this data, and more of these incidents occur on the 2 days over the weekend than they do in the 5 days during the week.
Mm.
So I've become, as you know, pretty good professional friends with many that we cover and risk manage. And when they say to me, I just don't think it's ever going to happen to me, I take a step back. I even want to hop on a plane and go see them in person. I can see Beck's face right now, right, Beck? It can happen to anybody at
Can.
any time.
None of
It
us
could
are
be,
immune.
it could happen again by October 1st, which is now 10 minutes less than when I spoke a few minutes ago. But that's the phrase to answer your question, right? Amanjot, it can happen to anybody at any time.
Yeah.
Or it's
We're
already
humans.
happened and you don't even know, right? You could get a call tomorrow from parents, my baby doesn't have the right or the correct parentage, or
Yeah, I
the
mean, listen,
wrong embryo was put back.
yeah, we are human beings. We are well-meaning. We are fallible, and we are, we're doing the best that we can. And I think that, it's, every time that we can kind of improve on our accountability and traceability and give that reassurance not only to ourselves but to our patients. And one of the things I've always said is I want to go home and sleep at night, and so if I leave the lab and I
Right.
go home, I want to be completely comfortable in my surroundings, and I want to not be thinking about things that happened at work. So yeah, I think
One of the
that's
one of the
yeah.
beauties of the model that we're dedicating this I3 seminar to is the fact that cryogovernance focuses in part on organization of the current inventory of storage in the lab, right? It's no longer, I have a tank sitting in the back room, I haven't been in there in 5 years, we're just pouring liquid nitrogen in. That's not accountability. Organization, track and trace technology, whether it's an RFID system. I mean, all of these things are really important for the future of patient confidence in our space.
Sure.
So I was just going to jump in there because you mentioned traceability, okay, and we've talked about GPS trackers which you can have on dry shippers, you can trace them, similar to Amazon. But I've got a question here. I'll probably give it to Cynthia actually. This is from Alistair McClure, and he's asking about the beacon system which Beck Holmes spoke about. It's on a beacon, it's on a carrier, and it's not on the actual individual straws, if you like. Should we be concerned with that?
I mean, listen, there's always, the way I think about technology is that it's a continuum, it's iterative, and there's always opportunities for improvement, right? So, what we need to do and what we should be focusing on is uniquely identifying each one of those cryo devices. I happen to have a cryo device here because I'm at the embryology training center. And so this is a cryo device typically used to vitrify eggs and embryos. And this needs to be labeled. It has to be labeled with a patient, with an ID number. It needs to be labeled with what is on the end of this, which you can barely see. But there's either an egg or 2 eggs or an embryo that's vitrified on the end of this piece of plastic. So how do we keep track of this piece of plastic, right? We can identify that with, with a system that automates the unique identification of that cryo device and generates a label, whether that's a QR code or that's a 1D barcode, whether there's some RFID maybe that's in that device. That device then is assigned to a carrier. There's some container that gets checked into and out of storage. This is not individually checked into out of storage. The container that it is being carried in and out is what is used to maintain that inventory. The system is designed to bolster the track and trace, the accountability, and the audit trail of that specimen. So we assign a device to a container. The container is assigned a position in storage. That container is checked in and out. That container is transmitting an identifying code that is pushed back through to a clinic's electronic medical record system, so that we remove all of that human-led manual labor of figuring out where the container goes. Does this tank have space? Do we figure out, where do we put it? And then we turn around and we write down that we put it in a certain place. And then we take that place that we wrote down and we type it into a system. So I think if we look at, the entirety of, the workflow, we have to continue to push on how do we remove opportunities for error? Is it automatically captured, that data? Is the position in storage automatically generated? Am I taking that human-led, focus out of it? I just think we need to keep doing better. So, to the extent that there's an RFID chip on that particular cryo device as well, I think that's a great, potential improvement. We do not have that today. I think that's something that we should consider
I
looking
think
at
that
in the
would be,
future.
I agree. Yeah, I want to chime in here that I think having it down to the device level would add that extra level of security and knowledge of where your samples are. It would be really nice to see that.
Yeah, I think we'll get there.
Yeah. While you chimed in, Beck, you were incredibly enthusiastic about storing offsite. Okay, and I've heard several colleagues around the world who think, or have said actually, that perhaps patients wouldn't like it, because the embryologist knows best and is caring for that. You've seen the success story of that, and you're very enthusiastic about, saying about offsite storage. How easy was it to change that? And were there any teething problems, or are there any sort of things that advice you can give us when people are considering perhaps moving off-site?
Yeah, I think working with somebody who has a reputation in the field is obviously going to give you that edge. Communication with patients. We have a website that's dedicated to CCRM and to Tomorrow, so that patients can go there and learn about the collaboration so that they can feel more comfortable. Being upfront with patients, letting them know this is what we'll use, this is the storage site that we will use. But you will still be a CCRM patient. You'll still get billed in the same way. We'll still have oversight of your embryos or your specimens, but they will happen to be offsite. Making sure that you're partnering with anybody that's going to be successful in this space is going to know that this is a 24/7 gig. This is not, working with an IVF center is not a 9-to-5 job. I think we all recognize that. We've got the weekend shipments, we've got the last minute at 8 o'clock in the evening calls to Cynthia, etc. How can we fix whatever situation we find ourselves in? So making sure that patients understand that we're partnering with people with a good reputation, that we'll have that 24/7 access to. So transparency, I think, is key for patients. They want to know what the whys and what's going to be happening at this offsite storage. Once you can reassure them of these facts, the majority of patients are going to be just fine with that.
Thank you.
It's
Great.
definitely a shift in what you have previously done and the previous norm. So, just like shipping embryos now is much more common practice than it was 15 years ago, 10 years ago. Shipping to bio-Rs is going to be much more common practice. And patients are educated, they are savvy, they talk to each other. And I think, word is out that these bio-Rs exist. And I think patients will eventually sort of feel that is more palatable.
Thank you.
Hey, Amanjot, Beck, as far as, we talked about, we all talked about the work required and the courier and the courier's here and we have to stop and, we have to break our concentration as embryologists in the lab. Do you think, we're moving towards a logistics specialist in each clinic? How are we divvying up that work? What does that look like? Is it, this embryologist is their turn this week to deal with all the shipments, and then they get excused from ICSI or they get excused from other work? How do we think about, how do you guys think about divvying up that at this point, given there's so many shipments? Beck, you mentioned 700. I don't even know. Just Amanjot, you've got the donor bank that you're dealing with. So there's shipments not just within your network, out constantly. So, you know, is that a special job description? Do you hire someone for that? Does someone get reassigned? Tell me how you think, tell
Yeah,
us how
I
you think about
think
that.
with how specialized it is, depending on the clinic size, it makes sense to have a dedicated individual. Shipping is not as easy as packing the tank. I wish it was, but for those that have shipped to other clinics, both shipping and receiving also, making sure that the records you receive are appropriate, that the physician has reviewed or your lab director has reviewed, and the converse or the inverse of that, which is when you're shipping out, that the receiving clinic is okay to receive, what their schedule process is. I mean, the volume of communications to get one shipment out the door, I would argue it's between 10 minimum if it's a clinic that you ship to
Yeah, agree.
regularly, up to 25 emails, especially for really unique cases where, let's say, we've had patients that have done cycles with one donor and then another donor, but they only want to ship donor A, not donor B. So it can be very nuanced. I think having a dedicated person, and in some clinics we have a whole team, you know, up to 5, 6 people that are handling, like Beck mentioned, I mean, a huge volume of shipments, just so that we have redundancy. I think in the same way that embryology lab needs redundancy, shipping is so important. Having that redundancy and someone available to manage those is so important. But would love to hear from Beck.
Agree, 100% agree. Something that we're bringing in is either a second admin person, or somebody who is just a transport specialist, to do that heavy lifting of the communication between patient, between clinic, between shipping systems. That it's just a whole reams of paper that the lab director will review before a shipment goes out or comes in. It takes a lot of person power to get that done. So having a dedicated shipping person, I think, is imperative and is the way to move forward with your clinics.
Thank you.
Yeah, and it's not even really embryology skill set, you know, it's, I mean, to reviewing the records, sure, but it's, you know, you're looking at a special job description, you know,
Yeah,
just for
yeah,
dealing, it's logistics and transport. It's
yeah.
an interesting evolution of
Different
our
mindset too. Yeah.
scope.
Great. Well, there's a lot of food for thought for the next CryoGovernance, okay, especially on those roles, whichever we can have. I'd like to thank you all. I think it's time to draw an end to this excellent masterclass, I think, on CryoGovernance. I'd like to thank everyone for attending. I'd like to thank my co-host, Cynthia Hudson, presenters, Beck Holmes, Amanjot Grewal, and Stephen Katz for fantastic talks. And really appreciate the time that you've spent on this topic and the excellent presentations that we've seen today. They really are something which, as you said, everyone has to see. So again, thank you all very much.
And thank you, Giles, as always, for being the amazing executive director and leader and helping moderate this session. And let's not forget the team from I3, the organizing team, you know, that this initiative got started in the first place. And that's, you know, Jacques Cohn, Peter Naj, Mary Savetes, Thomas Elliott, Fran Farley, Violetta Sora. You know, there's a lot of work that goes on to put on these webinars. And, you know, I don't think that anyone should take that for granted. The next I3 session that you won't want to miss, session 162, it will be entitled Smart Choices, Open Doors. That will be Tuesday, October 14th. And that is all about clinic management. And, you know, now that we've covered CryoGovernance for what, the 7th, 8th time, I think, you know, continuing on that discussion, let's continue to figure out how we improve our internal laboratory processes so we can better serve our patients.